Namaste, this is Dr. Vinod here, and I hope you're doing well. Today I'm going to talk about an extremely common problem that many of us suffer from. It is low back pain. Now in this video what I'll endeavor to do is to try and speak about why back pain happens, what are the common problems that can be associated with the back pain, and what are the things that you can do to try and minimize the risk of getting back pain, and also how to treat it effectively once you get low back pain. It's a very big and vast topic, so I might not be able to cover it with just one video. So I'll probably make a couple of videos to cover this as comprehensively as possible. So it is said that about 85% to 90% of us could suffer from low back pain at some point in our lifetime. It is a problem that we seem to have picked up when we evolved from creatures which are walking on all fours to creatures which started walking upright. It's an extremely common issue. So even if you've not suffered from back pain in the past, or you're not suffering from it at present, it is worthwhile knowing about low back pain, because the chances are that at some point in your lifetime you will suffer from back pain. So it is worthwhile taking some preventative action at this stage to try and reduce and minimize the risk of getting low back pain. Now there are numerous causes for low back pain. But for the sake of this video and this talk, I'm just going to limit myself to a very common cause of low back pain, which is what we call mechanical low back ache or low back pain. Now it is to be noted that for certain types of back pain, which are associated with other symptoms, which in medical parlance we call red flag signs, which are, in other words, danger signs, you need to seek prompt medical attention and not just try to treat the back pain yourself. These red flags are things like if you have very severe pain which happens after an injury or a fall, or if your age is less than 20 years, or if you're older than 55 years of age, if you have pain which is persistent for longer than 6 weeks in spite of taking conservative treatment and rest, and if it's associated with some kind of numbness or weakness in your lower limbs, if you have associated urinary problems or numbness in the seat or the buttock area when you're sitting, or if there's a marked weight loss or associated pain and swelling in joints of your body, or if you have other systemic issues like fever, then you should not sit on this and should seek prompt medical attention as soon as possible, preferably consult with a spine specialist. So coming to our topic of today, which is mechanical low back pain. So what is it and what causes it? It is a pain which is usually felt in the lower part of the back and the upper buttock area. The pain can sometimes start all of a sudden when you've been bending down to pick something up from the floor, or if you are just leaning forward and then straighten yourself up, or if you've had a small minor fall, or if you've been sitting for a prolonged time in a chair and then stand up and start feeling a sudden pain or catch in your back. The pain can also come up if you've been standing for a long time in a certain position, or if you've been sitting for a long time in a chair. The pain is usually accompanied by a feeling of extreme stiffness and tightness in the lower back, which you might feel a decrease in flexibility of the back when trying to straighten up when standing. The pain sometimes can radiate from the lower back or the buttock down the upper aspect of your thigh at the back. It can sometimes even radiate down to the front of the hip area from the lower back. The pain from mechanical low back pain usually does not radiate below the knee. So if you have pain which is like a sharp pain or shooting down the back of the leg into the foot or the toes, then it might be a sign of a trapped nerve, and it's not a pure mechanical back pain. It may be something more sinister like an intervertebral disc prolapse issue. So what causes low back pain? Now, to understand what causes back pain, we have to understand a bit about the anatomy and the biomechanics of the spine and the lower back. The spine is made up of various structures. In this model, I'll just explain them to you. You have the bones, which are called the vertebrae. Then you have the discs in between the bones, which is sandwiched and which provides a bit of compressive elasticity. And then you have the facet joints, which are between the bones. There are 2 facet joints at every level. And then the bones are supported by structures called ligaments, which are like belts, which help to bind the bones together, which are not shown in this model, but they are present, which run all the way from the top to the bottom and at various places in the spine. But the most important bit about the spine is the muscles which surround the spine. You have the muscles in the front, you have muscles on the sides, and then you have muscles at the back. It is these muscles which play a very important and a key role in supporting the spine. In addition to this, you have muscles of the pelvis, because the spine is joined to the pelvic bone by the 2 sacroiliac joints, and then you have muscles which run all the way from the spine across the hip into the legs. So you have the psoas muscles in the front, then you have the gluteal muscles, which are the muscles of your buttocks. Then you have the hamstrings, which are the muscles at the back of your thigh, and then you have the quadriceps muscles, which are the muscles in the front of your thigh. The spine is well supported by these muscles, and there is a very fine mechanical interplay and balance between the various muscles, which, if disrupted, can result in the low back pain. So problem with any of these components, the bones, the ligaments, the vertebral discs, the muscles, can result in low back pain. So the 2 most important factors that are contributory or which result in mechanical low back pain is 1, sitting down and having a very sedentary lifestyle. And the other one, which is related to this, is having a pot belly or belly fat, obesity, and having weak abdominal muscles. Now, most of us spend a lot of time sitting down, whether it is sitting at home watching television, using your computers, or sitting and traveling, commuting to work, or traveling longer distances, or then again at the workplace, sitting at the desk using your computers, or reading or writing and doing desk-based activities. We most of the time tend to find a very comfortable place to sit, so we tend to sit in sofas which are well cushioned, and sometimes it is softer than what it needs to be, and this can contribute to the problem. As humans, we are not designed to be sitting for long periods of time, and hence, at least not in sofas and chairs like we do. So this leads to a lot of changes in the spine. It can tend to cause an increased load on the intervertebral discs, which are present between the bones. This leads to degeneration and dehydration of the discs. It can lead to putting a lot of stress on the ligaments which support the bone, because if you're sitting all the time, there's increased pressures down your spine, and this can put a lot of strain on the ligaments because they are the supporting structures of the spine. There may be early degenerative changes in the facet joints between the bones of your back, which can lead to early arthritis in your spine and spondylosis. And it can also put a lot of strain on the sacroiliac joints, which are the joints between the spine and the pelvis, which can also lead to low back pain. The most important factor among all this is ultimately muscle weakness. That's the end process usually, and this is the most significant cause, but the good thing is it's a reversible cause.
So the take-home message is that the poor posture along with prolonged sitting, along with obesity and belly fat, leads to muscle imbalance, and this leads to increased loads in the spine. There's weakness of some muscles and tightness of some others.
So what are the initial treatments you can do yourself if you develop acute low back pain, say after lifting something heavy, or if you've had a back strain? The first thing you should do is obviously rest the back. Don't lift anything heavy, not to sit for a prolonged period of time. Avoid things like stair climbing and brisk walking during the time that you have the severe pain. Obviously, analgesics or painkillers have to be taken along with muscle relaxants, which help reduce the muscle spasm of the back and will help you to relieve the pain and the stiffness in your back. Then you have heat application. You can apply hot water bags or hot towels to the back, which help to again relax the muscles of the back, reduce muscle spasm, and also give you some amount of pain relief. If the pain is very severe, then you can use a lumbar corset or a belt, which can help to support the spine. But this should be used only for a short period of time. You don't have to take necessarily bed rest. You can be up and mobile as the pain allows. And if you're lying down on the bed, it's best to sleep on your back But when you're sleeping on the back, it's a good idea to put a pillow underneath your knees across so that the knee is in a slightly bent position when you're lying on your back. Lying on your side is okay if you can manage it, but very often you find that patients with acute back pain find it very difficult to lie on their side. Video, I will be showing you some simple exercises which will help to stretch some of the muscles and also strengthen the muscles of the back, which will help to relieve the symptoms. But to continue on in this video, there are certain questions which I get asked commonly by patients, and I'll try to answer them. Now, the first one I get often asked is walking good when you have low back pain? Now, if you're used to walking, then by all means do continue walking. Just have to be a bit careful and cautious when you're walking on uneven ground, if you're climbing a lot of stairs, or if you have to walk longer distances. Of course, walking is good because it helps to strengthen the muscles of the leg and also the gluteal muscles, and this helps to relieve the symptoms of back pain. The second question is, do we need to use an orthopedic mattress? Now, various companies have come out with what's called orthopedic mattresses, but really there is no evidence to show that these mattresses are in any way orthopedic. What you need to aim for is to get a mattress which is not very soft, that your body just sinks in when you lie in them, or it should not be too hard that you start getting pain at the bony prominences of your shoulder blades and your pelvis and your seat bone and all that. So you just need to find a mattress which is somewhere in between, a via media, wherein you have about an inch or so of compression when you're lying down on the mattress, and which is comfortable when you're sleeping and does not wake you up because of pain due to the mattress. Now, often it's a question of trial and error. Sometimes you just have to try a few mattresses on before you're comfortable with one. So yes, there is no such thing as orthopedic mattress for back pain. Do we need bed rest when we have back pain? Acute back pain, maybe bed rest can help, but often it's mentioned that it's best to keep mobile and as active as possible even when you have low back pain, because studies have shown that you tend to recover much quicker if you continue to do all your routine stuff. But you just need to avoid prolonged sitting and traveling, and also obviously avoid forward bending and activities which involve lifting and carrying objects. Do we need to use a lumbar belt or a brace in the short term when you have acute pain? Yes, it's a good idea to use it for a couple of days, but then after that it's best to get rid of the brace and not use it anymore. Another question is, can physiotherapy help? Yes, it can. It can help in two ways. One is it helps to reduce the pain and the muscle spasm. There are therapies like interference therapy, also called IFT. Then you have TENS. All these are pain relieving modalities which physiotherapists can apply for low back pain. That brings us to the end of this video. I hope you have enjoyed watching this and also have learned a few things about the basic biomechanics of low back pain, why it happens and what we can do to treat this condition. Now, it's very important that we do certain small measures like taking care of our back, avoiding certain things, improve the posture, and also do the exercises regularly to try and reduce the chance of this happening to us. In the next part, I'll be showing you some simple exercises that you can do at home, which will help to reduce the symptoms of back pain if you have one, or it will help to prevent the occurrence of back pain if you've never had back pain in the past. So if you like this video, please do press the like button, share the video with people who might benefit from this, do subscribe to my videos and press the bell notification icon on the side of the subscribe button, which will help to keep you notified of further videos to come. So as always, keep moving, keep fit and stay healthy. This is Dr. Vinod signing off. Namaste.
If you like this video or found it useful, don't forget to like, share and subscribe. And if you want to be notified of further videos coming up, please do press the bell icon which is next to the subscribe button.